Safety and Health Officer 2. I now invite the Secretary of the Division of Health, Wellness and Social Protection, Assemblyman Dr. Faith B. Israel, to address you.
Good morning, and thanks to those who are viewing this media conference. Our aim today is to reinforce the fact that we now have to figure out how we are living with COVID-19. This means ensuring that we protect our economy, but it also ensures that we protect the children that we've now sent back to school. Because having spent 2 years without schooling, without face-to-face schooling, the world needs to get back to the point of living safely with COVID-19. I would like to highlight several facts. One, COVID-19 is not over. We are now in that phase that is known as endemic. I know we tend to hear the word endemic, and because it begins with the word end, we think it means we no longer have COVID-19. But allow me to explain 2 or 3 different things to get us to this point. One, an epidemic happens when we have increased number of cases. At the beginning of 2020, we had an epidemic because we had increased numbers of cases. We then had a pandemic, which is what the World Health Organization announced, because we had an epidemic in every country or in every region of the world. That is why we were using the term pandemic for the last 2 years or so. We are now at the point where we are endemic, meaning that the number of cases is consistently high, but we have cases. We have been blessed to have the variant now that does not seem to be as deadly as Delta. We all remember in the last part of last year, in November, December, we had some of the deadliest months. And that is because the variant that was pervasive at that time was the Delta variant, which was getting us very, very, very sick. And unfortunately, many of our friends and family died. We are blessed now that the variant that is available now, that is being spread now, is not one that causes such severe illness. But I want us to be conscious of the fact that Omicron is milder does not necessarily mean that Omicron is mild. We must make that distinction. As a result, it's critical for us to think through what we need to do to protect all of us. Today, we are going to focus with my colleague, Assemblyman Zorisha Hackett, and the technical team, both from health and education. We are going to focus on clearing up some of the issues that we've picked up over the last couple weeks as we've rolled out going back face to face. So this is an opportunity for you to think through, for you to think with us, work with us on what has worked over the last couple of weeks, what has not worked over the last couple of weeks, so that we can ensure that we go through and we ensure that our children are able to live safely, even in the middle of this COVID-19 epidemic. Thank you.
Press conference before we head into the question and answer segment with members of the media. Dr. Faith B. Israel.
Thank you again, Davia. Because we are talking about children, particularly children in schools, I wanted to highlight a situation that has come to my attention within the last couple of weeks, and that relates to the fact that even though when we started talking about COVID, we were very clear that children were not as badly affected by COVID-19 as older people or people with comorbidities. We have a situation in Tobago, though, where we have identified at least 2 confirmed cases of children who were COVID-19 positive and who became very, very, very ill. We have a situation where we've had at least 2 confirmed cases of what is known as Miss C, and Miss C refers to multi-system inflammatory syndrome in children, which in essence says it is your systems, your respiratory system, your heart and your lungs and all of these different parts of your body become inflamed. And we've had at least 2 cases recently where we've had children who were COVID positive at some point before. Usually Miss C comes around a couple weeks after the initial infection. So your child may have actually gotten COVID positive, may have recovered. You may not have even recognized that the child was COVID positive because of the period that it happened, but you're realizing now that your child is ill. As I said before, we've had 2 confirmed cases. So I wanted to highlight this this to the public so that you pay very close attention to your children, particularly since we've now returned to face-to-face teaching, particularly since we now have cases within schools and so forth. Please pay very special attention to these symptoms. If your child, particularly if you know that they've had COVID and they have an ongoing fever, if they have an ongoing fever with any of the following, please contact your doctor, your pediatrician, contact us. Those additional symptoms include stomach pain, bloodshot eyes, diarrhea, dizziness, a skin rash, or vomiting. Again, if you've had COVID in the family, if you're not sure you've had COVID, but your child has had a persistent fever, and that fever is now accompanied with stomach pain, bloodshot eyes, diarrhea, dizziness or lightheadedness, skin rash or vomiting, these are signs that your child may actually have Miss C. Now, Miss C is one of those things that we can treat, and we have actually been successfully treating the cases that we have in Tobago. I would like to really thank and congratulate the health professionals at the Scarborough Regional Hospital who were able to pick up that this was not just a normal thing, and were able to pick up that these children actually have Miss C and have been treating with it. Again, this is a very serious condition. This is a condition that can affect your heart. It's a condition that can affect your lungs. It's a condition that can affect your brain. It causes inflammation in all of these areas, or in one or multiple of these areas. So your child needs to be really, really closely monitored. What is actually recommended is that if we recognize that your child has Miss C, that the child is actually hospitalized, so that there is 24-hour observation of the child. Because we have situations where we need to refer to cardiologists and so forth, the individuals, the health professionals at the Scarborough General Hospital are in very close contact with all of those professionals. If we do not have them on the island of Tobago, they are in direct contact with them in Trinidad, and they've been working very closely to ensure that we treat our children with Miss C, provide the best care to them, and thus far we've been able to do it. So if you are a parent and you have a child with fever and with any of these other symptoms, stomach pains, bloodshot eyes, diarrhea, dizziness, skin rash, and vomiting, don't just think it's something simple and not to be worried about. We want you to be concerned, and we want you to reach out to the medical professionals for help. With that, though, I would like to use this time to plug one more thing. And it's a thing that we've been talking about practically half of last year and all of this year. And that is to get your children vaccinated. We have the vaccines for children over 12 to 17. Those vaccines have been available. If you've gotten vaccinated already, or if your child has already been vaccinated, 12 to 17, the boosters are available. Contact the CMOH's office, 800-HEAL, to determine the best time to come and get your vaccine, or you may go back to the health facilities where you got the vaccine to determine when it is time to get your booster. We may have also heard an announcement from the Ministry of Health where we will be getting vaccines for children 5 to 11. So we've been vaccinating the 12 to 17s, and in short order, hopefully by the end of this week, by the middle end of this week, we will have the vaccines that are available for children 5 years and over. So again, I am encouraging you, because we actually are now seeing these cases of Miss C, where we have children who have gotten very, very sick. We are just appealing to the parents again to please consider getting your children vaccinated, because Miss C, this multi-system inflammatory syndrome, is as a direct result of a child getting COVID-19 infected and causing the systems in the body to not function the way it should. With that, I would like to encourage everyone to continue, as Dr. Hoyt said, continue following the rules, continue following the recommendations. They are tried and true. Something as simple as washing your hands with soap and water, because the lathering of the soap actually causes the protein ring of the virus It breaks it apart. It causes it to no longer be there. And if the protein ring is gone, the virus cannot survive. That is why we're asking you to wash your hands with soap and water. If you don't have access to soap and water, use the hand sanitizer, because the alcohol in the hand sanitizer does the same thing. We are asking you again, we still in Trinidad and Tobago have mask mandates, and you need to continue wearing the mask in close contact above your nose. It needs to cover both your nose and your mouth, because COVID-19 is spread through droplets that come out of your nose, droplets that come out of your mouth. Again, if you are ill, stay home. Depending on the situation, you can either call the education's health unit if we are talking about children in school. If you're an adult, call 800-HEAL and we can arrange to have you tested. Again, keep following the protocols, keep following the rules, and we would be able to continue living with COVID and figuring out how we can get this balance that is so needed. With that, we open it up for questions.
Thank you, Secretary Assemblyman Dr. Faith B. So members of the media, you're now allowed to ask questions. Remember, once you have a question to pose, just indicate by raising your virtual hand. Rashad Khan, Guardian Media Limited. Good morning, Rashad.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited here today. I have two questions this morning. Firstly, Dr. Israel, I would just like to follow up on that point you were making about vaccinations. Now, those 5 to 11 vaccines have arrived in the country as of 6:44 a.m. this morning. And I know it usually takes around 2 working days before it starts to be deployed within the population. But what I want to find out is, what is the strategy you all are going to use in order to encourage and get those shots into the arms of those children? And my second question is to the gentleman who gave the breakdown of the COVID-19 cases in the schools. I'm sorry, I did not catch your name. I had some technical difficulties on my end this morning. But I just want to know if we can get a further breakdown. I think it comes to giving these numbers, we also need to take it into context. I want to know how many schools are there on the island, how many teachers and students there are, how many of them would have tested positive, but also how many of them would currently be in quarantine as well. Thank you.
Certainly. So the good thing about Trinidad and Tobago, and particularly Tobago, is that we've had a very good history of childhood vaccinations generally. We know that with the last 2 years, because of a lot of the misinformation that we've had about COVID-19, there has been some hesitation for the COVID-19 vaccine. But we are going to continue in Tobago, working with our teachers, principals, schools, children, working with our pediatricians, working with our communities to continue providing the correct information so that parents can make the informed choice to get their child vaccinated. It's one of the reasons we spoke specifically, because I think one of the things because COVID-19 was one that was very mild in children before, we thought that we could just get away with not doing it. But now, in particularly since in Tobago, we've seen at least 2 cases of missing. And those 2 cases have come up within the last couple of weeks. We need to rethink whether COVID-19 can cause a significant damage to our children. And the fact remains that it is causing damage. And we have these cases that we need to be very concerned about. So we are hoping that the parents, you've in the past ensure that your children were vaccinated against all of the other things we get vaccines for. The yellow fever and the whooping cough and the measles, mumps and rubella. That has been our tradition. We've boasted in the past about having very high vaccination rates for all of those. And we are hoping that the parents continue to protect their children by allowing them to be vaccinated, because it is the safe thing to do at this point.
Thank you, Dr.